As technology continues to advance by leaps and bounds, many medical professionals have found it essential to learn to adapt by specializing even further within their specialized fields. And that includes the world of orthopedics. I'm Jim Masters here in Carmel, New York, at the headquarters for Somers Orthopedic Surgery and Sports Medicine Group. And we're here today to find out how they've become one of the finest musculoskeletal groups in the Northeast and how they're adapting to the latest technologies.
What makes Somers Orthopedic Surgery so special and so different than other practices is that we specialize just in musculoskeletal care. We're not an internal medicine group. We are a single specialty group for the musculoskeletal care of the patient. So we have every type of orthopedic care under one roof. You know, we have specialists in every area who not only specialize in the area but love what they're doing. So they take a special interest in you as the patient, in your care, and improving your condition. So it's an exciting time in medicine, especially in orthopedics, because there are so many new things for us to do to help patients.
Yeah, I think it's just a matter of time as you live and stay active that sooner or later you're going to develop a pain of one sort or another. The most common area sometimes is low back pain. Here at Somers we have several different doctors that deal with low back pain and the treatment thereof.
I think the founding of this group 20 years ago by Dr. Buchalter and Fauser was based upon that concept of caring for the patient, that we've put the patient first, that their interests and their needs are, of course, extremely important, and getting them better is the goal always. From my standpoint as the spinal surgeon, fortunately most people don't need surgery, but I'm able to then offer them care that is also that is non-surgical. They can stay within this group without going to outside sources because we can coordinate care in that fashion. For those patients that eventually do need surgery, of course, that is where my role becomes more paramount.
The disorders that I treat involve mostly musculoskeletal problems involving the areas of the neck and back, shoulders and legs, whether they be acute or chronic injuries or athletic injuries. To try to get them back to function as best as possible, as quickly as possible.
I focus my practice on non-surgical management of musculoskeletal injuries. So most patients are quite happy to hear that when they come in the door, there's a good chance that they won't need surgery. And for various conditions, joint sprains, muscle strains, back pain, tendinitis conditions, things like that, most of those things can be managed non-operatively successfully, and that's where I come in.
I went into rheumatology because it gives me the opportunity to develop long-term relationships with my patients. I really enjoy my job because it gives me the opportunity to help patients who are in pain. I think that with a lot of the medications we have available today and with the time that I spend with my patients, I can help them overcome a lot of their pain and their needs to make their lives better. And it's that one-on-one relationship with the patient that really makes me love my job.
Hand surgery is a unique field within the broader scope of orthopedic surgery, but one of the greatest advantages to being in an orthopedic group is accessibility. With so many physicians and offices, we can get patients in a very timely fashion.
Well, a big part of taking care of patients these days is keeping their mobility and their level of activity at a maximum. Over the course of over 20 years, I have performed total joint replacements on patients to keep their independent lifestyle, to get them out of pain, to allow them to continue to do the things they love to do. That's one of the things I love the most about my job, is to be able to take people who are suffering, taking chronic pain medication, missing out on life, and turning their life around to the point where they can get out and do the things that they love to do.
My immediate feeling when I came here was it was a very personal place to come. I felt very comfortable with the office staff. When I met Dr. Buchalter, I was very happy. He did not want to rush into surgery right away. It was a good 10 months before we decided to do the surgery. And I did come back quite a few times, and we just weren't sure. I had many tests, and finally I decided I'm going to go ahead with the surgery, which I did. and everything worked out really well. I was very happy with the whole procedure.
The ability to surgically treat people and athletes has always been an attractive situation, and certainly has been that over the past 35 years.
My current interest is in sports medicine. I mainly focus on taking care of athletes with shoulder and knee injuries. On the cutting edge of very advanced sports medicine techniques, using minimally invasive techniques to reconstruct torn ligaments in both the knee, the shoulder, the rotator cuff, and that's really my focus of my orthopedic interests.
The majority of the patients that I do see are active individuals, and even though they're not playing professional sports, they're doing things on the weekends, or they like to run or jog or go to the gym or play golf or what have you. And their main goal is to try to get back to doing the things that they love to do. So I got to use the experience I gained by taking care of professional athletes on everyday people to help them accomplish that.
I take care of pediatric orthopedic patients with all types of overuse injuries, from Little League baseball pitchers to senior citizens who are 85 who are trying to still play tennis, because there are a lot of overuse injuries from training, and my job is to get them back and keep them playing.
Anytime during the day, you have resources at your fingertips. We have conferences with each other all the time. Sometimes they're formal, sometimes they're not. Instead of a one or two man group, when you have to look into the literature and spend a lot more time on the phone speaking to colleagues, we have ease and accessible information 10 feet away from us all day long, and having a lot of experience. Between the 12 people in the group, we've got well over a century of experience in orthopedics, and that's a great value for us in the group. And I really love taking care of people. So the combination of sciences, anatomy, sports, and a desire to help people keep me in this white coat and feeling good every day.
There's always traditionally been a big migration of patients that would travel long distances to go to, quote unquote, the Mecca, the place where orthopedic surgery is higher quality than elsewhere. We find that here we give the same quality of care that you would get in a teaching institution. In fact, we're affiliated with a teaching institution, and most of the doctors here have academic appointments at New York University School of Medicine. We have a tight relationship with the physicians in the city, being on faculty at these hospitals. The advantage of being here with us is that we do your surgery. This is not a teaching hospital. Each of us as an attending orthopedic surgeon will do your operation. We'll see you after the operation, care for you in the hospital as well as in the office. Being located close by, living within a reasonable distance, if you have a problem or a complication, you don't have to drive down to New York City to have that complication taken care of. You can come to our office where we're available 7 days a week, 24 hours a day. So not only do you get the care of your own doctor operating on you and caring for you while you're in the hospital, you also have the care post-operatively if you have questions or concerns or problems, to know that we're always close by and we're always available for you.
It's now easy to see why Summers Orthopedic Surgery and Sports Medicine Group has become one of the finest musculoskeletal groups in the Northeast, and how they are adapting to the latest technologies. For Close Up on America's Business, I'm Jim Masters.